Okay. This is, I think we initially had this set from just her hospital follow-up.
I wanted her to see a urologist. How far we are.
Okay, so we saw the urologist one day this week, and they put her. They put her on that Mybetriq.
Myrbetriq.
Yes.
Myrbetriq, correct.
Because obviously always having to go to the bathroom and
frequency and all that.
it seems like it's helped. I do think that when she
Good.
feels like she now has to go, I think it might be a little bit of anxious because she's leaving the house or something.
Correct. But in general, you see it's helping?
It seems like it, yes.
What dose she's on, 25 or 50?
I don't know.
It comes in 2 doses, 25 and 50 milligram. If she's already on 25 for a week, she can double it and see if it helps more.
Okay.
Okay?
Good to know.
Yeah.
Okay. So yeah, they did that, and they actually, said it wasn't a UTI. Well, this time it wasn't, a UTI.
I'm falling apart, Satish.
You got to be strong. You got to be positive.
So what did the heart doctor say? The heart doctor said that your heart's amazing.
Wow.
So that was.
And who was the heart doctor she saw?
Hold on. Qureshi.
Oh, good, yeah.
So basically what she said was they put her on, because here's her blood pressure chart that we've been taking.
Sure.
But her blood pressure's all over the place. So they feel like that's probably what's causing the dizziness. And she actually saw a neurologist this morning.
Oh, okay.
Who kind of agreed with that too.
Yeah, there are some readings I see. Then again, it's almost normal. Then again, a little bit.
Because we can't figure out what's causing the dizziness.
What did the cardiologist say?
Just that basically they'd rather her numbers to be like a little bit on the higher side in this, not the lower number.
Correct.
So that it's pumping, I guess, through her,
Yeah.
And that when it goes low, that could be what causes her to feel shaky and dizzy.
Because I think her body might be used to higher blood pressure. You see what I'm saying? Her body and heart and
right.
For us, for outsiders, it may look high, but for her body, maybe that's okay for her to be a little on the higher side. You see what I'm saying?
Okay, yeah.
So I would agree with the cardiologist maybe to keep it at a higher level.
Okay.
So did he decrease the dose? Did he do anything?
They left the
amlodipine still.
So we haven't given her that since one of the days. I think Annie texted you and it was low, so we did not. She hasn't had it since then.
Oh, okay, good.
But this metro, whatever it is, they just said that would help lessen the swings.
Which one she's on now?
METOPROLOL.
Oh, metoprolol. Okay.
Yeah.
That's a good one too. That's a good one actually. So she's not on amlodipine anymore, right?
We haven't given it to her, no.
Yeah, hold off on that for now. Hold off on that. And what dose she's on? Metoprolol 25 or 50?
The
or 100.
Metoprolol, whatever, is 25.
Okay, she's on a very low dose. On the days if you feel that your blood pressure is trending down, take half of it.
Oh, take only half of that.
You don't want blood pressure to go too low.
Gotcha.
Okay.
I hope the dizziness, your dizziness is it's so much more severe since the hospital. Or your dizziness.
Yeah, that's why.
Well, it's in the hospital and since the hospital, that's been your, like she's afraid she's going to fall. And we actually brought in, because they suggested either a rehab or a night nurse, so we brought in a night nurse at night. Because she's like, even when she goes to the bathroom with the walker, she wants someone, you get dizzy.
what about seeing an ENT doctor?
Okay, so that was my other question for you. Can you look like in her ear? Can you look in her ears?
Yeah, let me take a look.
Because-
maybe dizziness, her symptoms could be not related to blood pressure. You see what I'm
It
saying?
could be in
It could be an ear issue. I'm going to give you a referral to an ENT doctor. He's in the same building. His name is Dr. Yantov. Okay?
Now, that side's the one with the hearing aid.
Oh, okay. Can you take off that for a second? Hearing aid? If you can.
Oh, yes. And then I guess you were gonna take her blood pressure, they said
Correct.
too.
I'm going to check.
He wants to look in your ear, so you need to take your hearing aid out for just a minute.
Yeah.
Sorry, it's so hard to talk to her with.
No worries. Let me check this side first.
He's just looking.
Just for a few minutes, okay?
She gets nervous.
I'm sorry. Looks fine. A little bit of wax, nothing to it.
Yeah.
A little bit, nothing to it. Well, just relax a little bit. Looks fine. I don't see any problem there.
So you would think though, if it was an inner ear infection, wouldn't.
See, we have to think in a bigger, not just the wax. You can't see the inner ear through the scope. Let the ENT do some testing. There are some special tests they can do and go from there. Okay?
Okay.
Yeah, balance tests. They do some balance tests, and they can also refer her to a vertigo clinic.
Yeah, because I wonder.
To reset the inner ear.
Because we wondered about that too,
Yeah.
because the shakiness is so.
And
It's so much now.
I know, that's why, maybe she needs some kind of a rehab, Yeah. Take a deep breath. Let me check your blood pressure. Can you move here closer to this
Yes.
one? So.
Let me see, do I have the brakes? I'm kind of a spaz with this.
I know. Little bit more here.
Right.
So
You want me to turn it on?
no, you're fine. I can listen through the flow. It's fine. It's hard. It's not easy.
Well, just the dizziness.
Especially when you don't know what is
Right.
really going on, and she continues to experience the symptoms. At least one thing is a good thing, that we know there's no cancer or a tumor or a stroke or something.
Right.
We know that there's nothing life-threatening. That's a good thing.
But I think the dizziness is it's rightfully so, driving her crazy, and she's
I'm
very.
wondering
She's
if it is due to a ear issue, Yeah. It's not bad. It's 130 or 80,
oh yeah,
which is
that's
pretty good actually.
yeah. Hmm.
So at the hospital they did CT or MRI or both?
Both and an MRA.
Oh, perfect. That's good.
I'm just falling apart.
You gotta be positive. See, one thing for sure, we know there's nothing serious which can kill you or hurt you, okay?
Yeah.
So I'm thinking maybe it's a ear issue. Maybe getting an opinion from an ENT specialist might help you, There's one here in the same building. I'll give you his name.
Did you understand that?
No, for
So, your dizziness,
Yeah,
it could be something inner ear.
yeah,
So we'll see a doctor about that, because people can get vertigo and inner ear infections and they don't even know it,
yeah.
but they're unsteady.
Oh, yeah.
So he said, you have nothing major, no cancer, no stroke, none of that.
No.
So he said that's a positive, and to be
Yeah.
positive.
So do I have to go to another doctor?
Well, just one more, but not today.
No. Thank you, Lord.
Are your kids going trick-or-treating?
Oh yes, they're all looking for. My older one, she has this inflatable sumo costume.
That's what my son did.
I'm like, how can you walk with that?
Oh, it's hilarious
I
to
know,
see
right?
them.
It looks cute, but you can't walk. She said, no, I'll deflate and walk.
Yeah.
And my younger one, she has the Jolly Rancher.
Oh, okay.
Yeah, okay, fine. And my wife is in India.
Oh, is
she
she?
went to see her mom. She was sick, not feeling well, so she's there. She's gonna come on next week. So I'm like, okay, that's fine.
He said, tell us about the urine.
About the urine?
Yeah.
About having to go to the bathroom all the time?
Yeah.
Well, he knows that.
Yeah.
But we think that medicine is helping.
Yeah.
And I think sometimes now you're just nervous when you leave the house. You
Yeah.
feel like you're going to have to go. But you've been better today.
Yeah.
Haven't you? Have you felt better today with that?
Yeah.
And you've been drinking your fluids.
Yeah. I know.
We were talking about his kids. They're going trick-or-treating on Sunday.
Oh, that's so cute. That's so adorable. Yeah.
How is her sleep?
2 little girls.
So,
The trazodone seems to be helping?
no. In fact, so the night nurse said that she doesn't think that that's actually helping. So one night that my dad forgot to give it to her, she actually slept better.
Oh, okay.
And
Then
la-
avoid it then. Don't.
Yeah, but I don't, we don't know. Is there something else? Or like part of me thinks maybe.
Especially if she has dizziness. I'm
Would
not
not-
comfortable giving any sleep medicine. Because she's
Yes.
prone for falls and makes her confused and
Yes.
groggy and all that. No, we should.
I almost
until we
thought
fix
maybe
the-
like a.
fix the dizziness until
Yeah.
we should hold off on that.
Okay.
Okay.
So I don't have urinary tract infection.
You don't.
No.
No, and we've done, the urologist did a bunch of tests. I think that, remember, they just say as you get older, sometimes you feel like you have to go.
Yeah.
But hopefully the medicine that they put you on will make you not feel like you have to go
Oh,
all the
yeah.
time.
Am I on that medicine already?
Yes.
Oh, yeah.
So, you hang in there, okay? Stay positive. Let's
Do you-
see the ENT doctor and we'll go from there. Okay?
Do you want to ask him anything else?
The what now?
Do you want to ask him anything else?
Nothing really. So I don't have urinary tract infection.
No,
Yeah.
you don't.
Yeah.
Okay?
Okay.
Let me get the paperwork.
Okay.
You'll have the ENT referral. Let's see what they say and we'll go from there.
Okay.
Okay?
How are the girls?
Girls are girls.
Yeah.
They are busy. They keep me busy and they're getting older. They're getting,
How old are they?
one is 13 and one is 10.
Oh.
So they don't need me as much.
How old are they?
13. One is 13 and one is 10.
Oh, yeah.
And they've seen her when they were little, when they were
Yes.
carrying, Time flies, I'll tell you.
I know. My kids don't trick or treat anymore.
Oh, I know. It's too,
They're 16, so no.
And my kids don't want to go to Disney. I say, oh, let's go to Disney. They're like, no, I'm not
You're
going to Disney.
kidding.
They want to go to Universal. I'm like, okay, fine.
Oh my gosh.
What can I get for chopped lips?
Chapped lips?
Try Aquifer. I like
Aquifer?
Aquifer is
What?
really good.
Aquaphor. And I have some of that.
Oh, do you?
Yes.
That's good, yeah.
Okay, let me get the paper.
Okay, thank you.
Okay, thank you. Good to see you.
Take care. Good to see you.
Yes, it is, yeah.
I'm still recording.